This year's ASH, we looked at our latest and longest follow-up for Ponatinib-treated patients from the phase 1 trial, which was around 80 patients in total, but we reported on the chronic phase CML patients and looked at response and time to response. And I mean, the conclusions are that in a heavily pretreated population, people with 3-4 lines of therapy, that major and complete cytogenetic remissions and molecular remissions were achieved in a majority of patients, even deep molecular remissions over time. The patients in the phase 1 trial, of course, were exposed to lower doses of Ponatinib, so having a look at the lower dose exposed patients, they actually did quite well compared to the whole group, which I think is encouraging as we're kind of now looking at lower doses of Ponatinib perhaps moving forward. Of course, the toxicity was a big question, and we looked at the total and the longest follow-up with regards to arterial occlusive events or venous thrombotic embolism, and I think the conclusions are we need to probably be able to scrutinize these a little better. The rates are quite high. We don't understand the mechanism of action or exactly how to reduce the risk. Good news is very few patients needed to discontinue due to those kind of adverse events, but they're real and need more attention. So it's sort of a risk-benefit ratio when it comes to Ponatinib, but certainly a very good drug for highly resistant patients. And I think we're looking at carefully now at the dose and the toxicity questions as we look to use it, in the appropriate population.